The seriousness of certain diseases carried by blood and other bodily fluids must today be addressed by all educators. As a professional in our educational system, you need to be aware of the potential danger of bloodborne pathogens, the infectious diseases carried by blood and other body fluids. The publicity surrounding the Acquired Immune Deficiency Syndrome, or AIDS, has heightened our awareness. What many people don't realize is that AIDS is not the only bloodborne disease that threatens the human body. The hepatitis B virus, or HBV, infects 300,000 people a year. HIV infects 35,000 people per year. The sad fact is, young people are not immune to bloodborne disease. You are in as much danger of contracting infection from students you teach as you are from any other group in society. The Federal Occupational Safety and Health Administration, OSHA, has issued a standard that can protect you from bloodborne pathogens. The standard covers workers who can reasonably anticipate contact with blood or other potentially infectious material. Your school system will identify the personnel whose job functions expose them to blood and potentially infectious body fluids. Not every school employee is occupationally exposed to bloodborne pathogens while performing his or her job. However, it is important for everyone in an educational setting to understand the dangers of infection and the safe procedures to minimize risk. Special education employees should take extra caution while working with severely disabled students who are more vulnerable to injury, have special medical needs, and are more dependent on adults for personal care. This program will provide facts on hepatitis and HIV, review the OSHA standard for occupational exposure to bloodborne pathogens, explain how bloodborne diseases are transmitted, and explain how you can protect yourself. Hepatitis means inflammation of the liver. There are several different strains of hepatitis, but the most common is the hepatitis B virus, HBV. If you become infected with HBV, symptoms can range from flu-like to symptoms so severe you require hospitalization, or you may have no symptoms at all. Unfortunately, many people are unaware that they've been infected with HBV. You can be infected and have no symptoms, yet your blood can be highly contagious, and the virus can easily spread through contact with body fluids of others. This means school employees can transmit HBV to sexual partners, family members, and even unborn infants. In most cases, the disease responds well to supportive treatment. In others, progressive destruction of the liver cells leads to cirrhosis and almost certain death. But even after many years of chronic hepatitis, some people never develop symptoms. For them, the only way to detect HBV is by blood tests. HIV attacks the body's immune system. A person can be HIV positive and remain in apparently normal health for many years. Yet most people who contract HIV will eventually develop AIDS. In the early stages, symptoms include fever, diarrhea, and fatigue. HIV-infected individuals who develop AIDS may also develop neurological problems, cancer, and other opportunistic infections. Although these secondary infections often respond to medical treatment, people with AIDS have so far followed a pattern of repeated infections, leading to eventual death. Currently, there is no vaccine to prevent AIDS infection. To effectively protect yourself against bloodborne disease, you must first understand how you can become infected. As different as the outcomes of bloodborne disease may be, the way it is transmitted in the workplace is essentially the same. HBV, HIV, and other pathogens may be present in blood and other material, semen and vaginal secretions, vomit, and torn or loose skin. Bloodborne pathogens can cause infection by entering your body in a variety of ways. Open cuts, nicks, and skin abrasions. Even dermatitis and acne can provide an entry for infection. Or infection can enter your body through the mucous membranes of your mouth, eyes, and nose. You can become infected by accidentally injuring yourself with a sharp object that is contaminated. Sharp objects include anything that can pierce, puncture, or cut your skin. Scissors, rulers, staple removers, needles, forks, knives, art supplies, sports equipment, shop equipment, fixed and portable playground equipment, and storage receptacles. Bloodborne diseases can also be transmitted indirectly. This happens when you touch an object or surface that was contaminated with blood or other infectious material and then transfer the infection to your mouth, eyes, nose, or open skin. Sound far-fetched? Not at all. Believe it or not, HBV can survive on environmental surfaces dried and at room temperature for at least 1 week. As unpleasant and scary as all this might seem, there's no reason to panic or overreact. The key to avoiding infection is first understanding the dangers you face, and second, knowing how to protect yourself. One of the basic problems you face as an adult in a school setting is the natural instinct to help an injured student. The younger the child, the more likely you are to throw caution to the wind and assist. Unfortunately, in today's society, you must consider every person to be a potential bloodborne pathogen carrier. Regardless of age or background, you must take appropriate steps to protect yourself. The OSHA Bloodborne Pathogen Standard requires your employer to create and make available to you an exposure control plan. The ECP will identify the personnel covered by the standard, analyze the potential hazards of each job description, and determine what measures will be taken to reduce the risk of exposure to bloodborne pathogens on the job. The OSHA standard provides various methods to reduce your risk of exposure to bloodborne pathogens. These include engineering controls, employee work practice controls, personal protective equipment, housekeeping, and administration of the hepatitis B vaccine. Keep in mind that none of these approaches is 100% effective, yet used together, they're like having a series of 5 protective barriers or shields, a personal fail-safe system against infection. Most approaches to infection control are based on a concept called universal precautions. As we mentioned earlier, you must consider every person to be a potential carrier. HIV and HBV infect people of all ages, from every socioeconomic class and in every state and territory, from rural areas to the inner city. That's why universal precautions require you to treat all human blood and body fluids as if they were known to be infected with HIV, HBV, or other bloodborne pathogens.